Hey, welcome back, Dr. Patel.
Thank you. How are you today, Dr. Maura?
Doing all right. I'm doing all right. I
Awesome.
wanted to talk to you, the expert, about autoimmunity. So tell me, what
Mhm.
is autoimmunity?
Yeah, autoimmunity is such a broad term overall. It's basically when one's immune system is almost overreacting and you get this inflammation cascade that can happen and cause a many variety of symptoms,
hmm
right?
So it's the immune system attacking itself for
Mm-hmm.
some reason, basically.
Mm-hmm.
What are some
Correct.
autoimmune conditions that we treat typically?
Yeah, oftentimes in practice, and I've seen the whole spectrum of different diagnoses, but things like rheumatoid arthritis, lupus, Sjogren's. When we talk about localized autoimmunity, like thyroid and Hashimoto's and
hmm
Graves,
hmm hmm
scleroderma, and the list kind of goes on. But there's
Yeah,
so many different like diagnoses out there and different autoimmune conditions,
yeah,
celiac,
yeah.
type 1 diabetes. So it really kind of varies by symptoms and
And kind
testing.
of covers the whole body, right? It can
Hmm.
affect any system. So what is
Correct.
the treatment process for you? Like, what do you think of when you see somebody for
Yeah.
this?
Well, number one is I always think inflammation, which is again, it can happen for any particular reason.
hmm
Typically, in traditional treatment of most autoimmune disorders, it's going to be to just bring inflammation down,
Right,
which usually is done with a pharmaceutical. They work, etc. But
right.
I prefer, things like looking at food, looking at anti-inflammatory natural agents,
hmm
potentially looking at something called leaky gut and intestinal permeability, where, hey, this inflammation starting in the GI, it's going through into the bloodstream and causing, again, immune system to go haywire.
To turn on, right.
But then you can also even look at environmental factors in terms of heavy metals, environment like mold, et
Anything
cetera.
can turn anything the environment that the immune system sees as an invader, right, is going to
Mm-hmm.
possibly activate the immune system.
Yeah, and
So it sounds
food,
like what you're,
obviously, right? So
yeah. So it sounds like what you're saying, the difference between us and like a specialist is like we're looking at cause, right? As opposed to just treating symptoms. We're trying to rebalance the
yeah,
body, which is possible. Is it with autoimmune?
yeah, yeah. And
Mhm.
I've seen some pretty interesting stuff in my experiences, but it's just looking for the why and then kind of working
Exactly.
backwards
Yep.
and chipping away at that inflammation piece, but
Right.
ultimately figuring out what's going on and getting a handle on that.
Yeah. Awesome. Thank you.
Mhm. Yeah, thanks for having me.